Our services, our safety. Across Asia and the Pacific, young people with diverse sexual orientation, gender identity, and expression often face barriers accessing the services they need, especially in areas of sexual health and HIV testing and treatment. They face judgment and stigma when seeking help and worry about their health, risk factors and sexual history being made public, putting them at risk.
I'm 17 and have always known that I was gay, but I never told my parents or family. They would not accept it and I would be breaking the law. Even in this small town, there is a place where people go, and it was there I met my boyfriend Anji. We have spent the night together a few times now. We were careful, I think, but Anji has told me he took a HIV test when he visiting the city and it was positive. He was upset and I was terrified. We were always careful having sex, but I need to check I am safe. But where can I go in my small town? What I have been doing with Anji is illegal, and I would bring shame to my family. Everyone would find out I was at the local clinic. And even if I go to the city, I can't get a test without my parents' permission, so they would know. I can't sleep, I can't study, I am so scared and worried. Anji's friends told me about a mobile NGO clinic that I offers free and anonymous testing and advice. I plan to go next week.
Abdul and others in his situation should not be scared. He needs and deserves help. Adolescents have a right to non-judgmental health services regardless of their age, sexual orientation, or background. Flexibility is required in the age of consent to HIV testing. The UN Committee on the Rights of the Child recommends that young people be given access to voluntary, confidential HIV testing services. National legislation shouldn't criminalize romantic relationships or consensual sexual activity between young people who are similar in age. Nor should there be discrimination on the basis of sexual orientation or gender identity. Young people have a need to be heard and a right to be listened to. It's their future, after all.